Adult use cannabis became legal in Massachusetts back in 2016, with the first pot shops opening up 2 years later.
Since then, there's been an increasing number of calls to poison control related to children ingesting edibles. 22 News I-Team reporter Taylor Knight has a closer look at this trend.
This is a graph of the total number of calls that the state's Poison Control Center has gotten since 2018, when those first marijuana dispensaries opened up. You can see that there has been a steady increase. The 22 News I-Team found out that many of the reports are for children eating edibles.
Every parent should know that this could be dangerous and should weigh the risks versus benefits of having these substances in their house.
Nationwide, calls to poison control centers about kids 5 and under consuming edibles containing THC rose from 207 in 2017 to more than 3,000 in 2021. That's a 1,300% increase, according to a study published this year in the journal Pediatrics. Here in Massachusetts, the Department of Public Health reports that the Poison Control Center has also seen an increase in calls related to pediatric ingestions of marijuana edibles. The numbers have been declining slightly since 2020, but children still make up 67 to 78% of calls about edibles.
There's been lots of state reports.
Dr. Ian Goodman told the 22 News I-Team that they've treated kids at Bay State Children's Hospital who have gotten into edibles.
We've had admissions to our ICU for what turned out to be marijuana ingestion in young kids. We've actually had at least 2 patients that I know of with respiratory difficulty because of this ingestion.
Symptoms can include confusion, sleepiness, or a fast heart rate or breathing. In severe cases, kids can have a seizure or go into a coma.
It has to do with the size and the fact that they don't metabolize these chemicals the same way that adults would, and the fact that the doses are so much higher in some of the edibles that we're seeing now.
The vast majority of the time, kids are finding these edibles at home. Parents can protect their children by keeping them out of sight, either behind locked doors or high up on shelves. The Cannabis Control Commission also has rules in place to try and protect kids. They can't be sold in the shape of a human, animal, or fruit, and they can't resemble characters or cartoons. Most dispensaries take that one step further by using child-proof containers. Dr. Goodman said if you do have edibles at home, make sure you have poison control and your pediatrician's numbers ready just in case something happens. You can find the number for poison control on our website, wwlp.com. Working for you with the 22 News I-Team, I'm Taylor Knight.